involved the Departments of Veterans Affairs and the Department of Defense in terms of identifying us as the fourth community to actually work on creating the virtual lifelong electronic health record for all servicemen and women and for veterans. We have a very large Air Force base here and VA facilities, and we've been trying to do this for a number of years, so to finally get the authorization and approval to do it has been pretty special for all of us. Well, I think partly because our community is very well connected in terms of data exchange as it is. The base, as an example, closed its hospital down a number of years ago, so our hospitals and all of them that we run provide all the inpatient care for the airmen and airwomen. So there's a clear reason for us to do that. We have a lot of transactions that are going on every day. Our specialists, our physicians in the community providing a lot of specialty care for the base, as well as for the VA hospital. So our ERs also get a lot of traffic from veterans for a variety of reasons. For us to be able to have the opportunity to do full data exchange is extremely important from a quality patient care point of view. Well, I think part of the reason was our original business plan, and you know, what we decided to do about 12 years ago was we made some decisions to share some technology assets. We made some decisions to consolidate our data centers so that all of our hospitals in this particular city, in the city of Spokane, could actually reduce its operating expenses in terms of running software. And what we decided to do was, over time, was to standardize what we were doing. And because of what we did, originally we were pretty highly criticized for doing that we were somehow or another not positioning ourselves to market services against each other. But what we really found once we started it was hospitals all over the region and physicians really felt very comfortable and with us becoming a trusted party and hosting all the data. And once doctors started having the full array of data availability, they really could see that they were taking better care of their patients. And what we did as hospitals was really determine that we should be marketing and competing on the quality of our programs, not on the quality of our intellectual property through health information technology. And so from that perspective, then we were able, all of our partners pay for what they do, but they pay less than if they were doing it alone or in the way that they were doing it before. So it becomes a win-win for everybody in that anybody that works with us provides additive value to our network, and through additional patient data, additional involvement, and so you know, we've been sustainable from the beginning. We have not been reliant really on grants of any sorts, and we've really kind of avoided that because you know, our business model is really to be efficient and to create efficiencies, which again is going to be very helpful with the new healthcare reform and accountable care organizations. And you know, that's always been our major driver, is how do we reduce costs, create the greatest opportunity for everybody to share this data, and really have it so that the physician is really the one and the patient at the end that really benefits the most from this. And because of that, I think our community has surrounded us and said, you know, it's the right thing to do. And our customers and doctors, all of our hospitals in the region, all participate and believe in it. And it's just become a fabric, really, of our community here. I think right now, especially with the poor economic times, you know, one would really have to question why you would start, if you haven't done this before and you're not in the business of doing health information exchange, why you would all of a sudden want to create a whole lot of capital infrastructure expenses. And so for parties that are not doing it, it might be worthwhile to look at others that are and either subcontract those kinds of services out or do things that exploit other existing assets that we have all over the United States. As we know, there's many of us that have been trying to do data exchange, and some are smaller and some are larger, but they still are assets that could be exploited in a way that reduces the cost. I think Many of us are concerned that, especially with the economics where they are, and I know in our state, our new forecast is going to show that we are a lot more in the hole from a budget than what everybody thinks. So that's going to make it more difficult for the state to look at, are they going to provide other kinds of basic human services, or are they going to provide health information technology? And the likelihood is that health information technology is not going to be high on the priority list. So for us to start something and not do it, or to reduce the scope of it, I don't think is really what we want. I think the other thing that's really important from my perspective on this, and I think in some markets people compete still on HIE or HIT, but it's really a utility is how we look at it. It's just like getting basic electricity to your home. And, we've really developed the attitude over time that, we don't want a doctor or a hospital to worry about, what are the engines, where's your electricity coming from? Is it water powered or is it nuclear powered? Who cares, right? They just want the lights on. And that's really what we want. We want people to be reliant on us. Our system needs to be up 99.99.7% of the time, and because of what we do in hospitals, and so it really should be something that's behind the scenes, and again, it should be every effort to minimize the cost on this, because the more we add on in terms of cost, the more difficult it's going to be for any of us to be successful in an accountable care organization, because that's going to require tightening of the belts, and if we're adding on cost, and it's kind of like a bow wave. Once you start this, you have additional costs that are going to go on for some time as you're building something like this, and capital replacement issues, and it's very expensive. And if you can do it in an efficient model like some of us are doing, if they can learn from that from us or try to duplicate it, try not to be so much in a competitive thing that we share our technology with every competitor in the region, and that's a big risk for people when they first start doing it.